Hello. Today we'll be discussing different situations that we face when you are working in medical ICU in emergencies and check some of the major steps that you can take while dealing with those emergencies. So there is a condition when you receive a PP-less or a pulseless patient, you check on two things. Either the patient is conscious or unconscious. Or on the other side, you will check short of breath or he is not short of breath, and if there is a respiratory effort. So now you can have four different situations. First is if the patient is conscious and he is short of breath. Second condition is if the patient is conscious and he has a normal respiratory effort. This can occur when the patient presents in shock after a period of vomiting, after episodes of vomiting or diarrhea. And then the patient can be unconsciousness with short of breath or gasping for breath or use of accessory muscles for breath. And the last one is unconsciousness without any respiratory effort, which is a difficult situation. Now, a condition in which the patient is conscious and he has normal respiratory effort. We would only start with inotropic sports. There are three different type of inotropic sports, and you will start them accordingly to decrease the BP and pulse of the patient. Now, in the second situation, the patient is conscious and is short of breath or gasping for breath. Then you would start inotropic sport and nebulizations, which are different. We will discuss these two in the later in the videos: inotropic sports, and type of nebulizations. The third condition in which the patient is unconscious, along with that he has shortness of breath and or there can be abnormal pattern of breathing. So for unconsciousness and PP-less and pulseless, you will start CPR, and as at the same time one of your colleagues would pass for ETT for abnormal pattern of breathing. ETT stands for endotracheal tube. Now, the fourth condition is the patient is unconsciousness without respiratory effort, PP-less and pulseless. Now, you would ask for ECG, check for brainstem reflexes, and at the same time, counsel the attendants. Now, there are two types of nebulization. First one is atom and clenil, and the second one is Ventolin. And you need to assess the patient accordingly to decide which type of nebulization you want to start on certain patients. Now, there are three different kind of inotropic sports. First is norpine, which is noradrenaline, which may be started at a maximum dose of 20 to 30 microdrops per minute in a continuous infusion. Then the second one is dobutamine, which is started at 12 to 20 microdrops per minute, again in a continuous infusion. Then the last one is dopamine, which is started at 12 to 20 microdrops per minute in a continuous infusion again. This is all for today's video. Thank you so much.